Hi, my name is Shannon. I am a student at Indiana State in the Doctorate in Athletic Training program. And today I'm going to be talking about a special test for diagnostic accuracy when evaluating posterolateral instability of the elbow. Specifically, I will be talking about the lateral pivot shift test of the elbow. This test is used mostly to rule in, so meaning that this test has a high specificity when a patient is unconscious. It has a 100% positive test when the patient is unconscious and are suspected of having and have a subluxing radial head for posterolateral instability. When a patient is conscious and awake and they have the pathology of posterolateral instability, there's a 38% chance or 38% likelihood that the patient will have a subluxing radial head or experience apprehension. So the clinician, when they're performing this test, you want to make sure that you're looking for the positive signs of a subluxing radial head or apprehension or any popping, clicking when you're going through the range of motion, which I will demonstrate now. So first you want to have your patient lying supine, and you will then raise their arm above their head and in a supinated position. So the clinician is going to be doing 3 different motions and while performing the test. So they're going to be applying an axial load with their arm, the most distal part, applying that axial load towards into the glenohumeral joint. So that's what we'll be doing here. And then with the other hand, the clinician is going to be applying a valgus force. So here you're going to be applying that valgus force, and then together congruently you're going to be putting the patient into flexion. Now, research says that most likely the patient will be experiencing symptoms of popping, clicking, any sort of audible, or also experience apprehension or subluxing radial head in that 40 degrees of flexion. You do not need to perform this test anything deeper into flexion past 90 degrees. Anything besides then, you'll experience no real stress to the intended structures. So again, you want to have them in that supinated position, axial force, valgus force, and going into flexion. Again, we'll do it here. Good. So again, you don't need to go anything past 90. Here would be 90 degrees for the patient. Anything that goes further, the structures will no longer be on stress. Another thing that you want to be make sure you're looking for is apprehension, any sign of pain or any uncomfortable feelings in the patient's facial expressions. If you have any questions on this, please feel free to ask. My email is srow9@sycamores.indstate.edu. Thank you so much for listening, and have a great day.